My name is Dr. Felix Ehiano. This presentation is on NACOSCE approach to vertigo, and this presentation is for educational purpose alone. The agenda for this presentation will focus on brief overview of dizziness, NACOSCE approach, which will center on focus, history, and examination. We are also going to look at the management of vertigo as well. By definition, there are various presentations of vertigo, and they include pre-syncope, which patient will complain of feeling faint or lightheadedness, sweating, and also clouded vision. Disequilibrium, patient feels off balance or unsteady when standing or walking. And the true vertigo is the illusion of motion at rest, feeling as if the room is spinning around. Psychogenic dizziness may be any combination of above symptoms, often difficult to describe or localize. The differential diagnosis of dizziness, vertigo, you could also have postural hypotension, vasovagal response, cardiac pathology, where you'll be looking at aortic stenosis, congestive heart failure, cardiac arrhythmia, and etc. Peripheral neuropathy, often secondary to diabetics, cerebellar disorders, ataxia, and Parkinson's disease, visual impairment, central vertigo, often with neurological symptoms, easy like tumor, stroke, multiple sclerosis, migraneous vertigo. You also will be thinking of anxiety disorders, mood disorder, panic disorders, and dizziness are treated with hyperventilation. History taking approach to NACOSCE is important. You also would like to confirm patient's name and age, gender of the patient. Is also you have to introduce yourself, greet patients, and feel that patient is also comfortable. Patient may complain of dizziness, spinning, lightheadedness, unsteadiness. Ask patient to use any word other than dizziness, very non-specific term. In your history, you'll be looking at the onset, present when sitting, the severity, the timing, the direction of spinning, and the duration, who could be in seconds, in hours, or in days, because this will also help you to look at the type of vertigo as well. There are some associated pathological symptoms like tinnitus, fullness, hearing loss occur only with vertigo episode or always present. There are some associated neurological symptoms, dysphagia, loss of consciousness, headache, ataxia, and 4, which is basically central etiology. You'll also be looking at recent upper respiratory tract infection, otitis media, trauma, and also be looking as patient for nausea and vomiting. History of travel, sick contact, rash, tick bite, presyncopic palpitation, shortness of breath, and change in vision, hearing, eye movement. These are the things you also would like to ask in taking history from this patient. It's also important you also look at red flags like syncope, angina, focal neurological deficit, headache, diplopia. In taking history, it's also important you ask for past medical history like history of hearing loss, previous laryngitis, syphilis, MS, Parkinson, transient ischemic attack, stroke, epilepsy, and cancer as well. So also ask for history of past surgery, any head or recent surgery. Also ask for gynae history, LMP, if current pregnancy and if it's majorly a female. family history of stroke, vertigo, and brain cancer as well is also important. As for medications, especially like aspirin, loop diuretic, anticonvulsant, and history of alcohol and caffeine is also important to ask as well. Social history, smoking, alcohol, STI, and also ask for history of exposure to high noise level as well. And it's important to review the system, especially the head, ear, nose, and throat, because that also will really help you as well to determine your diagnosis. Um, in respiratory, as for difficulty breathing, MSK, as for numbness, weakness, and for ENT, as for ear pain, fullness, and tinnitus as well. It's important to also examine a patient with vertigo, do a general approach of ABC, taking vitals of patients, especially the blood pressure, the heart rate, respiratory rate, and SpO2. General appearance of patient is important too. Look at the ear, look at the oral mucosa, and do central nervous system examination as well. And then fundoscopy is also important for this patient. But the special test you have to do is the disc high speed position, which is diagnosis of BPV as well. In managing patients with vertigo, it's important you start with your investigations, doing complete blood count and differentials, your electrolyte, creatinine, also look at chest X-ray, EKG, check if patient is also alcohol level, stress ECG, Holter monitor. It's also important you do audiography, basically Weber and renal test, vision test, blood glucose as well. Thyroid function test is important to look at, syphilis screen as well. CT, MRI are important to also look at. Treatment. Treatment is dependent on the underlying causes. For BPV, you did the Emplin maneuver. For Meniere's disease, avoid triggers like caffeine, alcohol, salt intake, and also give patients supportive treatment during acute attack. You could also think of antihistamine, antiemetics, anticholinergic, diuretics to reduce endolymphatic fluid. Surgical treatment is also important, but usually is the last resort. Vestibuloneuritis is usually self-limiting, but patient can benefit from supportive treatment like antihistamine, antiemetics, short-term vestibular compressions, treat vestibular lesion via surgery or radiotherapy as well. Thank you for this presentation.